I'm Dr. Weston Spencer. I own Weston Spencer DDS and Associates in La Jolla, California, and I would give Curve a 9 out of 10. The biggest business problems that I feel like we solve with Curve is accessibility and workflow within the office. The ability for me to be able to access my patients anytime I want. That to me was one of the most important things when I got going with Curve about 5-6 years ago. I took over a new office that was completely paper, everything paper. And I plopped down 4 Mac computers, one in each operatory, connected it to the Wi-Fi and connected it to Curve, and I was off and running right away. So the immediate ability for me to put the notes together, put everything for insurance, take the x-rays, do everything all in one, have it in one place, and not have to have a server was what I wanted to do when I had a small business. Now my business has grown and has had other needs, but I still utilize Curve for the fact that I don't have to have a big IT system or a big server to back it all up. I know it always works. Another big business problem for me when I first opened my practice was the fact that every time I saw the internet struggle, or not necessarily the internet, but the practice computers and the other practices I work would struggle, it was always the server. And everybody always blames the server. The server's not big enough, the server's not fast enough, it's not doing this, it's not, like I wasn't getting access to what I needed, the images and the other information I needed to see, because it was always the server's fault. And so we would always have to call somebody and get them to come over, and we were kind of being held hostage until that happened. Since I've had Curve, honestly, I can say once or twice for a couple of minutes had my internet become boggy or slow, and maybe it takes it a second to refresh or do something, but I've never been down, so to speak. And so again, the accessibility to your information all the time, every time, reliably, that to me is the most important thing, and I think what Curve does really, really well in terms of supporting me as a dentist. My favorite thing about Curve is being able to bring in a new employee or a temp employee. Every time somebody comes into my office, every time I ask them, I say, hey, have you ever worked with Curve? And every time they're like, no, I've heard of it, but I've never worked with it, or no, I've never even seen it before. And I show it to them, and by the time they're done with the very, very first patient, they already know how to do something with it. Right? So for me, the ease of training somebody on a new practice management system, there has not been one time, even if they're an older person, I don't know, by older, I mean like over 55, oh my gosh, but in the dental world, I've been doing this for 35 years, that's kind of old, and they're used to Dentrix or EagleSoft or the basic ones, right? And so for them to be able to say, oh, this is actually really, really easy to get up and going, and I get this, and it's very simple for me to go from the chart to the front to the back and back into. So for that reason, I think that's my favorite thing, is to show off to a new employee or somebody this new system that is new to them and they're excited to use it. It's sexy, it looks good, it shows well, and then it's easy to use. So people are a lot more likely to jump on board and be willing to train on it. My least favorite thing about Curve, I think, would have to be reports. And I say that with a little bit because I know that being involved with Curve, and for as long as I've been involved with, every time I've had a problem or needed help to create the report I'm looking for, if I call support, they'll help me to get there, right? But the first time I sit down and I'm looking for something on my system, I'll struggle to find what I'm looking for. But if I call support and they support me on it and they help me to create that report, then I usually have it going forward. So I guess I would say every time I have somebody who on the outside wants to look in my practice from the financial or the reporting side of it, they struggle and I struggle to get them what they want until we get the answers from Curve. But thankfully, support is usually pretty quick, and they usually get me what I want. I don't think there's ever been a time when they've said to me, we don't have that information. So I guess that would probably be when I sit down to do something, I want it right away and I can't figure out how to do it. And that's usually the reports. So if somebody is considering Curve, I think first and foremost, the thing they should be doing is connecting with a doctor who utilizes Curve. I get those calls a lot. So, well, not a lot, but maybe once a month or every other month, I'll get from somebody who's considering it. And it gives them a chance to ask questions to me about what I specifically use it for. So I think that's first and foremost the most important thing. Talk to someone who's using it. Share your experience of why you're trying to consider something with another doctor using it, so that hopefully it makes sense. I think doctors need to talk to doctors and make it make sense for their business, because they may have something unique going on. I had a friend who was in a particular space who wanted Curve so bad, and the building he was in did not have access to good internet. Just didn't. No matter what they did, and the building wasn't making it accessible, so it just wasn't going to work for him, really. Like, he had really bad internet. But this was 3 years ago, you know? So you want to make sure that, one, you do have good internet. I think you also need to make sure you can get access to really, really good internet. The other thing I would consider, and this is just anecdotal evidence I'm actually a partner with 2 other dentists in a multi-group practice situation that we've created. And one of our goals was to have cloud-based practice management software and have the same thing amongst all of us. I was the one main Curve user, and since 2 out of the 5 offices have incorporated Curve, and we're working on the other ones as well. And one of my partners is, before he went to dental school, was an IT specialist, knows a lot about the ins and outs. So he knows a lot of what you guys know on the Curve side that I don't know, and what to look for to make it successful. We tested 6 or 7 different cloud-based programs, right? Open Dental and some of the other ones, Dentrix Ascend. We got access to the ones that weren't even released yet, that they were beta testing. And I was really pleased to hear my one partner, who wasn't on Curve and is going to Curve now, was blown away with Curve, honestly. And I expected him to be very, very picky about it, but he was stoked on it. He was like, "Why haven't you told me all this, and this that it has?" And I'm like, "I've been telling you for 5 years, man. You just haven't listened to me." But I would say that in testing side by side 7 different practice management softwares, hands down. Now, not everything is perfect, and I'm not saying Curve is perfect for everything, but for what we wanted to do, to be able to access all the office's data from remotely from different places. If we were going to have an operations manager look at 5 different practices, we needed cloud-based, and we needed reporting to be cloud-based. We needed access. We didn't want to work on servers, and we didn't want to work on team viewers and all those other things. So when we tested them all, Curve hands down came back like the most user-friendly, most willing to work with us. And so far they've delivered on that. Anytime we've had a specific report or specific issue, they've always fixed whatever we needed done. And that was really helpful from a group standpoint. So that's one thing I would consider, is that, look, I'm one that not only did I dive in headfirst with Curve 6 years ago and have been always happy with it, but it was nice to test it again with everything else that's available and still feel like, yeah, we're using the right thing, and the one thing that I believe is the best thing going forward for groups. So I hope that helps at least kind of paint a little bit of a picture. But again, I think most importantly, it's good to talk to other doctors and get their opinions who are using Curve.